When we talk about blood-borne pathogens, the foundation is universal or standard precautions. This means that all blood and body fluids are considered potentially infectious, no matter what the situation. The major blood-borne pathogens include the human immunodeficiency virus, or HIV, the hepatitis B virus, or HBV, and the hepatitis C virus, or HCV. The Occupational Safety and Health Administration, OSHA, has a specific blood-borne pathogen standard. This requires every facility to have a written exposure control plan. Exposures are divided into categories. Category 1 includes workers who are exposed to blood and body fluids every day. Category 2 covers those who are regularly exposed but not on a daily basis. Category 3 includes workers who are never exposed. Employers are required to provide the hepatitis B vaccine at no cost to all employees in categories 1 and 2. It is also essential to identify tasks that carry risk of exposure. To minimize risk, laboratories must use engineering controls, such as safety-engineered needles, pipetting devices, and work shields. Employers must also provide personal protective equipment at no cost. Gloves, lab coats, and safety glasses are examples. Beyond equipment, good work practices are critical. Hand washing is the first line of defense and should be done before leaving the lab, before working in a biosafety cabinet, and after removing gloves. Never mouth pipette. Do not eat, drink, smoke, apply cosmetics, or insert contact lenses in laboratory areas. Used needles and syringes must not be bent, broken, sheared, or recapped. Blood or body fluid spills should be cleaned immediately using a 1:10 dilution of household bleach. That same bleach solution should also be used routinely to clean countertops, phones, and keyboards. If an exposure does occur, whether through a needle stick, splash, or broken glass, it must be reported immediately, followed by medical attention and documentation. Both the exposed person and the source patient must be tested for infection. Employees have the right to know the results, but confidentiality must be observed. Employees are also entitled to medical consultation. And remember, universal precautions apply not only to patient samples, but also to any reagents prepared from human blood or body fluids. Finally, the biological safety cabinet is a vital piece of equipment. It allows safe manipulation of infectious materials, reduces risk of exposure to both personnel and the lab environment, and directs airflow through high-efficiency filters. Every biosafety cabinet must be certified annually and anytime it is moved. When working in the microbiology laboratory, it's critical to remember the importance of biological safety cabinets, or BSCs. First and foremost, you must always monitor airflow. The airflow in a BSC protects both the worker and the laboratory environment from aerosolized pathogens. If the airflow is disrupted, the protective barrier is lost. Biological safety cabinets should always be used when working with specimens that could contain organisms spread through the air. Examples include Mycobacterium tuberculosis, which causes TB, Coccidioides immitis, the fungus responsible for valley fever, Francisella tularensis, which causes tularemia, and Bacillus anthracis, the agent of anthrax. In short, proper use of a BSC is one of the most important steps in preventing laboratory-acquired infections, especially with highly infectious airborne organisms. The packaging and transportation of specimens and microorganisms is strictly regulated to ensure the safety of laboratory workers, transport personnel, and the public. Regulations are enforced by the Department of Transportation, or DOT, and the United States Postal Service, or USPS. When specimens contain chemical, biological, or radioactive hazards, they require specialized shipping and handling procedures. In general, specimens must be placed in non-breakable, leak-proof containers that are securely padded and sealed before shipping. For higher-risk materials, a second or even third layer of packaging may be necessary to protect against leakage. Every package must be clearly labeled to indicate the type of hazard it contains. Regulations can be complex, including specific requirements for package size, permitted volume, and the category of infectious substance. Special training is often required to ensure compliance with these regulations. Alongside transport safety, we must also consider the safe handling of hazardous chemicals in the laboratory. OSHA's Hazard Communication Standard, also called the Right to Know Law, ensures that employees are fully informed about the hazardous chemicals they work with and how to protect themselves. Each laboratory must maintain a chemical hygiene plan, a written document that explains what to do in case of a chemical spill, fire, or exposure. It also describes control measures, which include engineering controls such as fume hoods, ventilation systems, and reinforced storage cabinets. Personal protective equipment, such as gloves, goggles, and lab coats. Employee hygiene practices, like frequent hand washing and avoiding food or drink in areas with chemical fumes. Fume hoods, which are used to protect workers from hazardous vapors, must be monitored periodically. Each facility must also appoint a chemical hygiene officer and provide training to all employees. For every chemical in the laboratory, a safety data sheet, or SDS, must be available. This document, provided by the manufacturer, outlines the risks of exposure, the protective equipment required, and what to do in case of an accident. Chemical storage also follows specific rules. Flammable solvents must be kept in a flame cabinet, although small 1-gallon containers may be stored under a fume hood. Corrosives must be stored separately from incompatible substances. The SDS should always be consulted for specific storage requirements. Finally, there are general safety rules to follow. If a chemical splashes into the eye, the worker must use the nearest eye wash station and rinse continuously for at least 15 minutes, followed by medical evaluation. If a chemical spills on the skin or clothing, the worker must use the body shower and rinse for 15 minutes, then seek medical care. Carcinogens and other chemicals that pose a risk to respiratory health should only be handled under a fume hood and with appropriate respiratory protection. When we talk about waste disposal in the laboratory, we are referring to hazardous waste. Hazardous waste is any material that may be flammable, combustible, ignitable, corrosive, toxic, reactive, or otherwise injurious to people or the environment. This category includes both infectious waste and medical waste. Chemical waste is regulated by the Environmental Protection Agency, or EPA, and the regulations depend on both the type and the amount of waste generated. Biohazard waste and sharps fall under the OSHA Blood-borne pathogen standard. They must be placed in orange or red plastic bags that carry the biohazard symbol. Sharps must always go into rigid, puncture-proof, and leak-proof containers. To ensure safety, these materials are best handled through autoclaving or incineration, which prevent transmission of infectious disease. Radioactive waste is regulated by the Nuclear Regulatory Commission, or NRC. Much of this material is stored until it has decayed enough that it is no longer radioactive, a process known as decay in storage. It is important to always keep hazardous waste separate from non-hazardous trash and to store infectious material in a secure area to prevent accidents during handling. Radioactive materials must be disposed of only in properly labeled containers. When working with larger amounts, protective shielding should be used to protect workers. Personal protective equipment and safe work practices must be followed at all times. Any exposure to radioactive material must be reported immediately, and medical attention should be sought. Radiation monitoring involves several tools. Workers may wear a film badge or dosimeter to track exposure. There are also exposure limits, with the maximum permissible whole-body dose being 5,000 millirems per year. Laboratories may also conduct a wipe test, where surfaces are wiped with absorbent material, and the wipes are then checked for radioactive contamination. In case of a fire, there are several immediate steps to take. First, alert the staff and rescue anyone injured. Then, pull the nearest fire alarm, close doors to contain the fire, and call the institution's emergency number. If the fire is small, you may attempt to put it out with the nearest fire extinguisher. Fire extinguishers are classified by the types of fires they handle. Class A extinguishers are for wood and paper. Class B is for flammable liquids. Class C is for electrical fires. Class D is for reactive metals. Many fire extinguishers in the lab can be used on classes A, B, and C. Some facilities also use halon gas systems. Halon is heavier than oxygen and works by displacing oxygen near the fire. It extinguishes the fire without harming laboratory equipment. To operate a fire extinguisher, remember the acronym PASS. Pull the pin. Aim the nozzle at the base of the fire. Squeeze the trigger slowly. Sweep the nozzle from side to side. When it comes to fire safety in the laboratory, remember the acronym RACE. The first step is rescue. Help anyone who may be injured or unable to move to safety. Second, alarm. Immediately pull the nearest fire alarm to alert others. Third, contain. Close the doors to the affected area to limit the spread of fire and smoke. And finally, emergency. Call your institution's emergency number. Only attempt to extinguish the fire yourself if it is small and safe to do so. By remembering RACE, you can respond quickly and effectively to a fire, protecting both people and the facility. Let's review electrical safety in the laboratory. Whenever equipment malfunctions, it must be locked out and tagged until it can be serviced. Even a small electrical shock, sometimes felt as just a tingle, must be reported. That piece of equipment should be unplugged and tagged until checked by a professional. Frayed wires and plugs must always be replaced promptly. All equipment should be grounded, ideally with 3-pronged plugs. If a worker is severely shocked and cannot let go of the instrument, the equipment should be unplugged without touching the person. Alternatively, the victim can be separated from the current by using a non-conductive object, such as wood. If the victim stops breathing, cardiopulmonary resuscitation, or CPR, must be initiated immediately. Now let's discuss compressed gas safety. Cylinders must always be stored vertically and secured with chains or anti-tip collars. They should be kept away from heat, electricity, or flammable liquids. The valve must remain covered with a protective cap until the cylinder is ready for use. When in use, pressure must be monitored daily, and every cylinder must carry a permanent label identifying its contents. Moving to regulatory agencies. The U.S. Department of Health and Human Services oversees several key agencies. The FDA regulates medical devices, blood products, and laboratory tests. The Centers for Medicare and Medicaid Services, or CMS, administers CLIA 88 and Medicare/Medicaid services. The CDC issues disease prevention standards and guidelines, though it does not have enforcement authority. The Office of the Inspector General, or OIG, investigates Medicare and Medicaid fraud and abuse and encourages laboratories to implement compliance programs. OSHA regulates workplace safety. The Department of Transportation oversees the shipping of hazardous materials, and the U.S. Postal Service regulates the mailability of etiologic agents. The EECC enforces anti-discrimination laws in the workplace, while HIPAA protects the confidentiality of patient health information, often referred to as PHI. The Clinical Laboratory Improvement Act of 1988, or CLIA 88, is a federal law establishing minimum standards for laboratory practice. It ensures accuracy, reliability, and timeliness of test results, regardless of where testing occurs. Regulations vary depending on test complexity. Waived, moderately complex, or highly complex. Provisions include quality control, proficiency testing, personnel requirements, performance improvement, and patient test management. All laboratories must be recertified every 2 years. Finally, let's review voluntary accrediting agencies. These agencies can receive deemed status, allowing them to enforce CLIA regulations as an alternative to direct federal oversight. They include the Joint Commission, which accredits hospitals and healthcare facilities; the College of American Pathologists, which inspects clinical laboratories; the American Association of Blood Banks, which accredits blood banks; COLA, which accredits physician office laboratories and community hospitals;